The primary symptoms of seasonal affective disorder that we see are going to be low persistent mood, low energy as well, an increased need for sleep throughout the winter months, and that makes a lot of sense because the days get a little bit darker earlier. We'll also see an increased appetite in some folks with seasonal affective disorder, and oftentimes that's manifested in a preference for carbohydrate-rich foods too. Some of the treatments for seasonal affective disorder, we think about 3 primary treatments that are supported by the scientific literature. One would be antidepressant medications. Those have been the mainstay for treatment of depression in general. Scientific literature supports certain antidepressants like Prozac or Wellbutrin, but I'd certainly encourage people to consult with their primary care physician if they're interested in going on an antidepressant. Another effective treatment for seasonal affective disorder will be psychotherapy. And oftentimes we think about psychotherapy such as cognitive behavioral therapy as the mainstay for depression treatment specifically. It can also be really effective for seasonal affective disorder. Again, we think about people with seasonal affective disorder having lower energy. Maybe they're not as engaged in activities that promote well-being or are values-based for them. So therapy can be really helpful in just having somebody that you can collaborate with to activate towards activities that provide a sense of purpose, meaning, especially in these winter months as well. The last evidence-based treatment that's particularly unique to seasonal affective disorder would be light therapy or a light box. These are really interesting devices that are commercially available. Typically, the scientific literature would support 20 to 60 minutes a day throughout the winter months. And the light boxes are measured in what's known as lux, L-U-X, or luminance. Typically, we see in the scientific literature about 10,000 lux is a pretty good dose for the light box. At the same time, much like with antidepressants or seeing somebody for therapy, I would certainly encourage people to consult with a primary care physician if they want to use a light box. You can get them commercially available, pretty easy to access, but at the same time, there could be some side effects like eye strain. There could be some interactions with certain medications like mood stabilizers or antibiotics, and I just want people to be sure that they're consulting with somebody who's also a professional in that way too.